Hi, my name is Jamie Heffron and I'm the diabetes educator at Atrium Pineville. You're watching this video because you've been diagnosed with diabetes, old or new diagnosis, and you're going to go home on insulin. So I'm just going to go over a few things of what you need to do when you go home to set you up for success. So first of all, diabetes. Why do we care about our blood sugar? Well, when your blood sugar is high, your blood gets very thick and sticky, kind of like you see in this jar. It sticks to all your vessels, making you feel very unwell, very tired, groggy, you might be very thirsty, peeing a lot. It also can increase your risk for heart attack, stroke, it can affect your eyesight. So it's really important that we want to keep our blood sugar as normal as possible. When your blood sugar is normal, your blood is nice and thin, like this jar, flows through your body, you feel much better, you're much healthier. So I'm just going to go over the things you need to do to help you to have better blood sugar control when you go home. So the very first thing is to watch what you're eating. So let's keep it simple when it comes to diet. When you have diabetes, a lot of people think when they're diagnosed, so I can't eat bread anymore, I can't eat pasta anymore, I can't eat, anything good in my life anymore, basically, and that's just not true. It's all about carb control. So we want to keep your meals between about 40 and 50 grams of carbs, meaning bread, potatoes, pasta, anything that's very carby. Make sure you're measuring out the portion to make it a small portion, increasing your vegetables, increasing your protein, and making sure you're drinking a lot of water is key. The only thing we really say you need to cut out of your diet if you do drink it is sugary drinks. So soda, juice, sweet tea, even fruit juice. Some people think fruit juice is very healthy, but actually it's loaded with sugar. If you can eliminate that from your diet, you will be much better off. And you will receive this book, Diabetes Management. I just want to let you know the page you can refer to is page 22. It goes more in depth about meal planning. Okay, so your nurse should give you this book when you go home. You will also get this book at discharge. This is our survival skills diabetes book. And if you go through it, you will see a lot of information on, or some more information I should say, on the way you should be eating. This is kind of a very visually easy way to see how you should be eating when you go home. So we covered diet. The next thing you need to do is try to increase your activity. Now, depending on your activity level, if you can't get up and walk around, even upper body exercises as much as possible will make a big difference in your blood sugar. But if you are able to get up and walk around, increasing your activity to walking up to 30 minutes a day is the goal. If you need to start small, that's fine. Start 10 minutes a day, 5 minutes. But walking will really, really help lower your blood sugar. And I'm going to also instruct you guys on insulin. I will instruct on basal and mealtime insulin. Whatever your doctor ordered is what you will take, but I just want to show you how to use it. So when you go home, your insulin will be loaded in a pen that looks like this. In the hospital, they use a vial and syringe. That's not what you'll use at home. Most likely you'll have a pen. You take the cap off. The insulin's already loaded inside. You do not have to load anything. You will see this number dial right here. You'll dial it up to whatever your dose is. I'm just gonna dial this up to 10 as an example. Here we go, see, 10 units. Now you will also get a box of needles from the pharmacy. This is all by prescription. You will not need to buy any of this over the counter. You will use a new needle with each injection. So I'm gonna show you how to load the needle on your pen. You will take the paper off very first, okay? Then you're going to put the needle on the end of the pen, twist it on. It doesn't have to be super tight, but just so you feel a little resistance. You'll take the clear cap off, and then the next step is you will take the needle cover off. Now, a good practice to get into before you give your injection is to prime your insulin pen so you know everything is functioning correctly. You will dial to 2 units, push this button at the end, you'll see insulin squirt out. You know your insulin pen is functioning correctly, insulin is coming out, there's no air in the needle. Then you will dial to your dose. Again, I'm just gonna use 10 as an example. Your dose will be listed on your discharge paperwork. So 10 units, your needle's primed, your dose is dialed, you're ready to inject. You will always inject in the stomach because we wanna inject in fat. Insulin goes inside fat and the stomach is the easiest to reach and has the best absorption. We're gonna pretend this pad is your stomach. You're gonna go straight in and hold this button down. Did you hear that click? You'll either hear a click or you'll see your dial go down to 0. You know that you've given your full dose when your dial's down to 0, okay? Now again, I'm just gonna kind of show you what we did here. We dialed it up to your dose and we pushed this down. You see liquid coming out of the end of the pen. That's how the insulin operates. All right, you're done with your injection. Now you're going to want to take your needle off and remove it. You can unscrew your needle and throw it in a sharps container, or you can put the cap back on like this and unscrew it so you don't, stick anybody, and throw it in the sharps container that way. And then you can put the cap back on and you're ready for next time. Okay, you will use this pen until it's empty. Each pen has 250 units in it, meaning I don't know how much your insulin you're going to be on, but you'll use it a few days up to weeks. You'll know it's empty because you won't be able to turn this dial. You'll know it's empty that way. So you're going to get several insulin pens at once. The pens you're not using, make sure you keep in the refrigerator. The pen that you are using can stay at room temperature for up to 30 days. So if you're going out to eat with friends, or if you're going to work and you're on mealtime insulin, you will need to take your insulin with you, and that will stay good up to 30 days at room temperature. So there's two types of insulin you could be on, basal and mealtime. Basal insulin is 1 shot of insulin per day. It lasts 24 hours. It's slowly released in your system. And then when you eat, you're gonna need to take something called mealtime insulin. That shot you will take before breakfast, lunch, and dinner. If you're not eating a meal, you will not take the mealtime insulin. So again, you will be on insulin, basal insulin, which is 1 shot per day, long-acting insulin, a slow release, and then you'll have something called mealtime insulin or short-acting insulin. You'll take that shot before you eat, breakfast, lunch, and dinner. If you forget to take your insulin, that's okay, just take it as soon as you remember. So if you finish eating your meal and you forgot to take your dose, just take it as soon as you remember, but it works best if you take it before you eat. So since you're on insulin, there is a risk of hypoglycemia, which is low blood sugar. You can read all about this in the books I showed you previously. But when you take insulin, you do have the risk of low blood sugar, meaning your blood sugar could be less than 70. In that case, you might get shaky, sweaty, you just don't feel very well. Make sure you're checking your blood sugar either with your finger stick machine or with your sensor that I'm going to show you. And if it's less than 70, you need to treat it with 15 grams of carbs, which is just a little bit of juice, about 4 ounces. 15 grams of carbs every 15 minutes until your blood sugar goes up. Now, if your blood sugar is low, it is an emergency. You need to treat it right away because you could get faint, you could pass out. That is something that needs to be treated right away. So I just want you to be aware of that. So it's always good to have something available in your car, at your bedside, just something to help get your blood sugar up. So this is a Libre sensor. The doctor or nurse might have given you one. I just want to show you briefly how to put it on. First, you open the box. This is what the sensor is going to look like. Now, I'm not going to put the sensor on me because I don't want to waste it, but I just kind of want to show you. You're going to unscrew it, and this is going to go on the back of your arm. You're going to take an alcohol prep like this, and you're going to scrub the back of your arm, and then you're going to take the sensor, and you're going to put it underneath your arm and push this in. You'll hear a click, and the sensor will deploy and stick to your arm. You're also going to need to download the app on your iPhone or Android. Search under your Google Play or App Store for Libre 3. It'll prompt you to set up the program. You will scan it one time, and then it will automatically send a blood sugar to your phone every minute, which is really, really great. If you don't have this sensor, you're going to get a finger stick machine at the pharmacy. You will need to check your blood sugar in the morning, first thing, before each meal, and before bedtime. Now, it might take you a little while to get there because if you were just diagnosed, your sugars might have been high for an extended period, but those are the goals. Again, 80 to 130 before a meal, less than 180 2 hours after the meal. If you have any questions before DC, just ask your nurse. And if you have any questions about your insulin dosing, you're going to need to reach out to your primary care provider, and they will help you adjust your doses as your body changes through this process. So I know this is a lot of information I've given you. You can refer to your books that you're going to take home. And really, it's just about a learning process. It's not about being perfect, but you need to make sure you, again, take your medicine as prescribed, watch your diet, and try to increase your activity. And I just wish you the best, and thank you so much for your time.